Now, you got a more important job, the star of getting us all healthy and getting our act together.
Well, it's keeping our country healthy, which is one of the best investments we can make as a nation, because it adds, if you can just get folks so darn healthy, they want to keep going at what they're already doing in life. It's worth about $1 trillion to our economy. But the host usually sits here. So I'm going to take the prerogative, Matt. This is like two Broncos in the arena, and tackle some of the biggest challenges that we are seeing on the inside. And if it's okay, I'll start with the corruption, the fraud.
CPAC is yours, Dr. Oz. Take it away.
Been wrestled the power from Matt. So if you're sitting in our seats, and Steph Carlton, Deputy Administrator, has been the architect of a lot of the really important work we've done around MAHA and around some of the sex-rejecting procedures that we're no longer paying for with tax dollars as we finish the process. Chris Klomp, Deputy Administrator in charge of Medicare, working with Secretary Kennedy, which you'll hear from him on Saturday. But Chris is the architect of the most favored nation drug pricing, which is the single biggest advance in affordability, which he'll regale you with. But let me start with something that is on all of your minds, because we've been hearing from you about it, which is the fraud, the waste, and the abuse, which we believe is taking $100 billion out of our healthcare system. But more than the money, if you're willing to steal someone's cash, you're willing to steal their health and even their life. And we're witnessing this happen in states around the country. Our administration has sent letters to Minnesota, where you saw what happened with Somalians and others taking advantage of the system, an autism program that was supposed to be $3 million. They lied and got mothers to lie that their kids were autistic. That's now a $400 million budget. That's tip of the iceberg. We've deferred a fair amount of money to them already to make sure that they fix some of the past billing they've done, but there's lots more going on. Los Angeles, the city of Los Angeles, has 1/3 of all the hospices in the entire country. Not California, literally, in the entire country, 1/3 of our hospices are in Los Angeles. That's impossible unless you're literally looking the other way, pretending it's not happening. We're seeing fraud in New York State, where the #1 job of all, Matt, the #1 job of all is not retail. You think about Manhattan and Fifth Avenue, the #1 job in New York State now is being a personal care assistant. Basically, you call up and say, I can't get the groceries upstairs, I want to hire my son, so the state hires your son. Federal taxpayers picking up a fair amount of the tab, most of the tab, and now that has become a jobs program in New York State, which I'm concerned about because we're hearing that unions are trying to get involved to unionize these folks, which just becomes a further grift on the system. And again, this is not a flaw for many, it's a feature of what they're doing. When they are able to do things that allow more individuals to get on these programs, by law, when you sign someone up for Medicaid, you also have to offer them voter registration. So there's a lot going on here that explains why people have allowed this corruption to persist, but it's there nevertheless. And you know, it's happening all over the country. South Florida has twice as many durable medical equipment suppliers as McDonald's. These guys sell wheelchairs and knee braces. Now, one unifying factor, there are foreign governments involved in some of these activities. I want you to recognize that. We have Cubans involved in South Florida. We have Russian mafia in California. We have Chinese involvement in Flushing, Queens, where I happened to visit recently, but it's involved in the boroughs. And we have corruption with Somalians that we mentioned in Minnesota. So there are foreign governments or foreign nationals being involved in a lot of these activities, and they're taking it, like Medicare is a piñata, and Medicaid is the fundamental safety net of the country is being whipped to try to get money out of it, and we have got to take this stuff on aggressively. And the president created a task force. Matt, he announced it during the State of the Union address. Vice President Vance is leading that task force. We had a press conference with him the day after the State of the Union. The first thing out of the gate was to make sure everyone knew we were going to put a national moratorium on new suppliers of durable medical equipment, so you can't scam us anymore. And we will not take a step back till we fix this corruption. And just to put some number, if you're worried about, how many people here are worried about Medicare being there for them when they get to 65, right? It will, if we deal with the corruption in Medicare, it will double the life expectancy of the Medicare Trust Fund, double it. So it's worth doing this. in addition to the fact that our most vulnerable deserve it. Now, I want to take that affordability message to Chris, because what he has accomplished is a signature achievement of the administration. Everyone said it was impossible. What was the problem, and how did you fix it?
Look, everyone here knows that President Trump inherited an unaffordability crisis, but he's working to fix it. Let me give you an example or two of what's happening. Right now, America develops life-saving medications only for the rest of the world to get them for a fraction of the cost. Get this, we pay 3 times what citizens of every other wealthy nation on the planet pay for the drugs that we developed here in the United States. We fund more than half of R&D. That's a global ripoff, and that ends. That's foreign free riding under President Trump. That's the end. There's a personal cost to this, though. It's not just big numbers that we talk about. 1 in 4 Americans show up to the pharmacy counter and they don't pick up their prescription because they can't afford it. That's a moral failure. That's a global travesty, and that ends as well with one simple principle: MFN, most favored nation policy led by President Trump. What does that mean? It means that we will not pay more for a drug than any other wealthy country. That's it, starting now. It's simple, it makes sense, it's powerful, and it's powerful because it's rooted in the principle of fairness. So already, folks said this couldn't be done, by the way. We've negotiated with 17 initial pharmaceutical companies representing the majority of the pharmaceutical industry. Already we're seeing other countries show up, and they understand, they got the message. If you want to continue to access America's life-saving innovations, you're gonna pay your fair share. And in the process, we've seen GLP-1s, life-saving GLP-1s that help with diabetes and cardiometabolic disease come down by half. Fertility drugs for families that are trying to grow their family that have come down by as much as 68%. This is affordability in the pockets of every American. This is fairness. This is the principle of America First negotiator that is President Trump. And that's what we've seen with most favored nation pricing.
Can I ask a question, Doctor? You have this question of what we pay for drugs, but it always seems to me like one of the biggest problems is everyone's taking too many drugs because they're not healthy. If we get everyone healthy, won't we have less reliance on everybody having to take all these medications?
We're twice as expensive in our healthcare coverage than any other country on the planet, in part because we're twice as fat as every country on the planet. And that is the core of the MAHA movement, which I'd love Steph to walk you through, because that has to happen. We must become healthier as a nation. It's not only good for you and your family and the people you love, but it's actually your patriotic duty at this point to stay healthy. You'll enjoy it more anyway, but we can't keep up. Our life expectancy is dropping despite these investments. Steph.
Yeah, I mean, I think the question so many families are asking is, why is it so much harder to raise healthy kids in America than it was a generation ago? It's because the system is stacked against families today. If you think about it, our grocery stores are flooded with ultra-processed foods. They're easier to find than fruits and vegetables are in many places. We've traded out physical activity, walking around outside, kids playing outside, for screen time. And we have a system that is rewarded and paid exorbitantly, I might add, when you get sick instead of focusing on keeping you healthy. That system is making us sicker as a country. Let me tell you this, the Trump administration is here to take on that system, and we're doing it. One of the first things Secretary Kennedy did was take on the food industry in Washington. All the lobbyists that made dietary guidelines confusing, that ended up influencing advice so that you weren't given the truth about what makes you healthy. And we changed all that last year. We got back down to common sense guidelines that are easy to understand, that are ultimately about taking ultra-processed foods out of our diets and eating real whole foods, fruits and vegetables, steak. They're about, instead of calorie counting and being on counting every brownie and feeling guilty about what you do, it's about metabolic health and thinking about being healthy and, again, eating these whole foods. Instead of these complex guidelines, it's about getting back to common sense, getting back to the truth, getting back to science. We started there, we didn't stop there. We're taking on the rest of the system, every single program in Washington, in the government, where the incentives are stacked against you, and we're refocusing on them, on how to make you healthy again. And if we get that right, it's gonna be easier to raise healthy kids in America, and almost more importantly, it's gonna be easier to live your fullest and best life as an American.
And Matt is a walking example of this. He looks like a gazelle or an antelope, but you know that's a good example.
That's because I eat a lot of charcuterie, okay?
So if I can pivot for a second. So the most ambitious health legislation ever was the president's signature working families tax cut legislation. And in that legislation, there are two things that I want you to have on the radar. And I say this to you because as CPAC members, you're the ones who go out and talk about this at the water cooler or the bar, or wherever these conversations happen. Issue number one, the president felt that America does best when it works. And so in the legislation, we have a work requirement for people to get free health insurance on Medicaid. Now, this was not done to be mean to people who are able-bodied on Medicaid. They were never supposed to be on Medicaid. When Medicaid was created 60 years ago, that wasn't even a thought anyone would entertain. But it's become the norm. And so the president said, and Congress passed the law, that you've got to work 20 hours a week or volunteer or go get an education. Community engagement, get yourself better. So this administration has gone out there, we've negotiated contracts, we're working and rushing on this to get it done by the end of this year, so that starting January 1st, to get and earn free health coverage, you have to do something to help yourself, to show you have agency over the future, which makes you healthier by itself. The other thing, Matt, the largest investment ever in rural America. How many of you live in rural America? Put your hands up. Oh, good. About 20% of the audience. Statistically, it's 60 million people. We are putting $50 billion into rural health care to right-size it, to get it back up to where the rest of the country is, because life expectancy in rural America continues to shrink and shorten. We are dramatically going to change that. This money is out in your states. You talk to your governors. You make sure the money goes out into the homeland, goes into the rural areas where it can do good, to bring in more healthcare workers, to bring technologies that can be beneficial. We don't want people dying because they grew up in the wrong zip code. All of us, any great country takes care of its most vulnerable. We're going to do that. Now, that stated, that's the major advance we're making here in America, but we have got a big threat. We're effectively, I guess, intellectual warfare with a country that is threatening us in many ways, but there's one you haven't thought of yet, and Chris is taking it on.
We face a national security threat right now that hasn't been named meaningfully until President Trump. It's not one of missiles and tanks, it's of laboratories and life-saving medications. It's a war right now with China on American innovation and biotechnology. Why does this matter? Why is this such a big deal? Well, while we were sleeping, China was planning and they were plotting and they were growing. Less than a decade ago, they counted for about 3% of all new pharmaceuticals coming to market. This year, they're verging on 40%. Why should you care? Because they're learning from us, they're stealing our IP, and there are real threats. This isn't just lack of access, this isn't just lack of market share. This is trillions of dollars of American IP being siphoned off that we lose. We'll lose our physicians, we lose our best scientists. Worse, we lose control of our destiny. We lose control of life-saving medications to a foreign country, a foreign power that does not share our values, but will dictate what medicines are made and who will get them. The good news is President Trump has named this, and there is an American First agenda right now. It's led by Marty McCary, the commissioner of the FDA, who's focused on this. We choose to believe in American exceptionalism. We choose to believe that America is at its greatest when you back us into a corner. And right now, China is trying to do just that. And it's been doing that for the last several years until now. Now we're focused on innovating. There are things that we can do. No longer should we take 15 years to bring a new molecule to market, a new life-saving medication. It's time for a new medicine's moonshot. Instead of the slog of 15 years, we should be sprinting toward 5. We should cut the price in half and lower. We need to bring new innovations in. We need to protect our IP. We need to incentivize not bureaucracy, but speed and American innovation. That's exactly what the president has called for. It's exactly what we're doing so that we can overcome this threat.
Now, it takes brave action, and you cannot bend to corporate lobbyists to accomplish these goals, because the Chinese have infiltrated at many different levels. So they come at you in a very clever way, but it has undermined our creativity. Now, there's a problem that was not created by some other country. It was created by woke individuals who have lost their way and who perverted science. We saw that during COVID, that you can take over science if you do it the right way. And they also try to do it with sex-rejecting procedures. Now, without getting into all the backdrop of what's wrong with people who think this is right, the president promised to address it. He campaigned on this, and it has been delivered to you because the president would not take no for an answer. This came up constantly. The president, by the way, can attest for all of us, he calls you at all hours. He will follow up on stuff. So Steph was the tip of the spear on this. It's the thing you applauded for loudest when we started. I'd love for you to just take a bow for doing it, but then explain, tell them what they've won.
Thanks, Dr. Oz. When it comes to our country's kids, I think that's very simple. First, do no harm. And you know, I'm a nurse, started my career working in a hospital with patients, and an important part of my training was to understand when it's important to slow down, ask hard questions, and protect the patient, especially when the stakes are this high. And let me tell you, when you've got little girls that think they might be little boys, and the first instinct is to talk about cutting off their reproductive organs, something is wrong. We've got to slow down and stop and protect these kids. So that's what we've done. We've slowed down, we've asked hard questions, we've raised the bar on science. And the odd thing is, I think a lot of parents in this country start to ask, why is it so hard to protect my kids? The reason is woke ideology is crowding out science. In this situation, the science is very clear. It's not there. The evidence is weak and it's missing, and people are jumping to these things that hurt kids. And so we've said, let's stop, let's go back to basics, let's understand where the evidence is weak. When a kid comes to you and asks questions because they're anxious or they're depressed or they're scared, let's go figure out the least invasive thing. Let's help them get counseling, go talk to their parents, have hard conversations before we try these experiments on kids. And let me be clear, we've stopped these experiments on kids.
You know, Stephanie, what if we stopped telling our kids that the world was going to end next year because of global warming? Maybe everyone would relax a little bit. What if we stopped telling our kids that all their parents and grandparents are racists who are hateful people and that America is this rancid place to be born? I think we create a lot of this anxiety in our kids with all this crap that's coming through phones and TV sets and everything else. I think that's almost like the great reset that's going on. There's something healthy about stopping to consume all that garbage.
Yeah, absolutely.
You know, I look at our healthcare system and our country's health, and I am more optimistic today than ever before in my life. Now, and there's a bunch of rational reasons for this. You know, there's a fine line between vision and hallucination, right? Other people have to see it for it to be real in a vision. But we have so many tools, and I've had great jobs, as you have, Matt. And you know, Chris built a massive business and gave it all up to come in. Steph was a massively successful corporate leader.
What do you mean, Chris is a future CPAC donor? Is that why you have me seated by him? This is good. I like this.
Never missing.
Never missing.
Yeah, don't turn your back on him. Just adjust your chair.
We just mingle this way.
But this is the best job I've ever had because of the people in the business. These folks gave up everything because this is a generational opportunity for us together to make this happen. And what I would love to open everyone up to a little bit is the possibility that technology might have a role here. We have parts of the country where we don't have enough doctors and nurses. We have technology because we're still leading in that space to be able to provide services that are supported with technology. If I'm a doctor, and I am a doctor, and I'm busy as stink, and I can't take care of everybody, if I have AI do the intake for my patient, that's a good thing. You should want that. It allows me to have more flexibility, look at you in the eyes, use my prefrontal cortex to read you, because that's what we do with our prefrontal cortex. That's why you learn so much from looking at someone in the face and studying them instinctively. That's why babies stare at us, they're learning. So we've got to take that natural human instinct that we have and do what America's always done. Innovate, grow, prosper, take risks, and support people who want to go in that vanguard. We're here as a team, on behalf of the president, recruiting you. Come work with us, chip in, write about us, talk about the things you've heard up here. Don't let folks out there tell you false narratives, because they will. defend what the heartland has always known deep in our hearts and our souls to be true. There is a North Star, and we're following it, and we will not be hindered or hobbled in any way as we pursue that. You've got wonderful folks who want this country to be great. Make sure you're there supporting, put wind in the sails, or put your own sail up. Do what Matt did, and just make sure you give people a chance to be heard. God bless you.
Yeah, great. I want to just say before we close, Barbara Lowy, stand up, Barbara. She's helping head up our MAHA coalition at CPAC, so everyone go see Barbara. She's like the smartest person about medicine you'll ever talk to. She knows it all. And know that I think this is a really important part of this coalition. You know, there's been conservative issues that are more routine as part of what might be part of an agenda for a conservative movement, but they've been lying to you. They tried to tell us all kinds of fraudulent things during all the corona stuff. We have found that medicine and science has been politicized. So take a healthy dose of skepticism as you consider these things. Join Barbara, join our cause, and let's give it up for these guys for really helping make America healthy again. Thank you. Thanks, Dr. Oz.
Take this.